Hi, Dr. Hemal. Thank you for coming here today and sharing some valuable insights to all the viewers. I wanted to ask you, as a nephrologist, what is your recommendation on water intake for good kidney health?
Thank you, Namita,
Yes.
for having me here. I've
Thank
seen
you.
your page, very inspiring work. As a nephrologist, my first point here will be that if you are a kidney patient or a heart patient,
Yes.
this advice doesn't work for you. Please talk to your doctor. But in
Right.
general, for
Yes.
everybody else,
Yes.
please listen to your body thirst mechanism.
Okay.
Now, we have a lovely mechanism set in which tells us when to reach out to water. But in general, answering your question, about 2.5 liters
Okay.
is great for someone who is active.
Okay.
And if someone is involved in outdoor sports or is in the sun a lot more, living in warm weather, they should add about 500 to that.
Okay.
So about minimum 2500 for them
Okay.
and 2 liters for everybody else.
Okay. So do you think age has anything to do with consumption of water? The elderly, should they consume a little less? The youngsters, probably less than 20 years of age, do they require more? Is it anything like that?
Absolutely. So, my general experience has been that the younger lot in the teens and even the young in the 20s and 30s, their activity levels are far higher.
Yeah.
And therefore their hydration has to be commensurately little more.
Yes.
So they should take 500 extra that we are talking
Yes.
about. The elderly, as they grow old, they are mostly indoors. Secondly is there is a problem of concentration of urine during the night time, and therefore the elderly will experience nocturnal frequency.
Yes.
And therefore this population, we request them to cut it back a little.
Yes.
And particularly cut back beverages
Yes.
after 6:37, particularly if it's something like a caffeine, tea, coffee, and those who are indulging in alcohol, they also need to understand that they need to take little lesser closer to the bedtime.
Last question, doctor, is that what if someone tends to have less water intake on a regular basis? Does that affect the kidney health?
Absolutely. So, one of the common problems that do arise out of this is kidney stones.
Yes.
When you have less water, you pass concentrated urine.
Yes.
And those who are immune to that problem will form stones because of the elements joining in a concentrated urine, forming a nidus for stone formation, which grows further.
Okay.
And the second thing is that those who are doing outdoor jobs, who are working in the sun in a tropical country like ours, it is very well known, like for example with farm workers, that micro damages occurring to the kidney due to dehydration over a period of time, that is over months and years, leads to kidney damage, and they need to be protected from that.
Okay. Thank you so much, doctor. I think this was such a inspirational learning for all of us to consume the right amount of water. Thank you.
Thank you, Namita, and a happy kidney health to everyone.
Thank you so much.